Hi guys, Ariana here at the AAFE Training Center. I'm going to show you guys a beautiful jawline transformation that I did with my patient. So I have my patient here in the chair, and what I do to really accentuate that gonial angle is I have the patient almost hyperextend in the opposite direction. So I really want to be down on bone, and I really want to do back of ramus and gonial angle to really get a good kind of sharp but feminine jawline. To give a little backstory on this patient, she had come to me with only having experience with lip filler prior and really felt kind of tired and just that she was starting to show signs of aging. So our approach with her was to just do a full facial approach. I wanted to kind of snatch her jawline and kind of support the lips that she had already had filled. And I did so by going down to bone with a needle on the back of the jawline, going down to bone with needle on the chin, and then I took a cannula to kind of blend the work that I did and disguise it a little bit more. So here you can see I go really slow with the jawline filler. I really just wanted to make sure that I was taking all the safety protocols that we teach in level 3. I went really small. I didn't put any more than like a small bolus. I'm aspirating and I'm just taking it slow. One trick that I really like to teach is how to feminize the jawline with filler, because I often see a lot of patients that are very nervous with getting jawline filler. They're nervous that it's going to make their face look masculine or boxy from the front. And on certain patients, this is what we want to do. But oftentimes, people want to really snatch jawline from their profile, but not necessarily from the front of their face, right? We don't want to see a super wide kind of bulldog look with jawline filler, which is why I always have my patients turn. And I will kind of accentuate that jawline backwards rather than out. Which is a very advanced technique, but I have seen great results with this and very happy patients when you can really have a snatched profile, and it really just kind of slims the face. I'm a huge fan of jawline filler, just because not only does it give a sharp appearance on the profile, but it kind of gives a more youthful look because it's masking any jowls, it's masking any submental concerns that patients have. And sometimes they'll come in, having concerns of a turkey neck, and all it is a little bit of a recessed chin or needing to extend that jawline and that chin. So it really just takes kind of the aesthetic eye and practice to really get used to doing this kind of filler. Now I'm working on the other side of the face, and you guys saw how long it took me on one side. Just because I take things really slow, I always kind of take a step back and reassess the work that I'm doing, which is why I take it slow as well. But I just, out of safety and just the look that I'm going for, I want to make sure that I never overdo it or I never put a bolus of filler anywhere that I didn't desire. So I'm just taking it slow. I went to the other side, and I did actually end up going back to the other side because I kind of do a little bit, and this is just a routine that you develop with time, but I do a little bit here, I do a little bit there. It's very rare that I do full correction and never come back. Because you start to notice different things, and as you correct, you start to notice even more asymmetries or one side being stronger than another. It just totally depends. So there I am with the gonial angle, and it looks like I took a break and kind of switched to chin filler. But I'm sure, just knowing myself, that I did go back. So I did actually, not seen in this video, ultrasound. I always ultrasound chins just out of safety for the patient. I just want to know where their artery lies and their anatomy, and just make sure that I am okay to go down to bone here, because it is a little bit more of a high risk area. So I did go down to bone, had a good aspiration, and then I gave very small amounts of, I used Juvederm Voluma. So very small amounts of Juvederm Voluma here because I just want to give a little bit of projection, but I don't want to go for too pointy of a chin. So just a small amount, and then I kind of want to blend the work that I did. So I am just numbing the porthole here for my pilot needle to go in so that I can do cannula. And I'm just kind of wiggling around and making room for my cannula to go in. I want to try to avoid poking the patient more than I have to. So I try my best to do a good job originally with this pilot hole so that I don't have to go back in and make too many holes with the patient, just out of comfort. It's, they're healthy if it's starting to clot off, but it can be a little bit more uncomfortable for the patient. I do want to say when I originally sat down with the patient, her concern was, jowling and signs of aging. But something else that I noticed is that she had volume added to her lips, which I'm not sure what they looked like before just because she came to me with her lips done prior. But they were starting to give a little bit of a shadow over her mental crease, and she had some mental shadowing, which not only do I want to blend for jawline, using this cannula, but I also want to kind of blend in that mental shadowing area that she had to just give like a fresher look. So that's kind of what I'm doing here. She did have past history of some acne scarring, so it's a little bit harder for me to get in there. But I just want to be very careful. I always want to know where the tip of my cannula is, and I always want to keep that cannula moving, which is what I'm doing here, just in that mental shadowing area. And I do still have Juvederm Voluma here. I'm still using the same syringe, and I'm just trying to kind of disguise that filler and give it a very natural look for the patient. I also want to hide anything that I did with needle, which gives a natural look, but just kind of blends everything, and it makes things just look seamless. I'm a huge fan of using both needle and cannula for this reason. They pair so well together. I kind of explain it to patients as back when I was a kid, we used to outline our photos. We would outline with a marker or a thick pencil, and we would color in with crayon, and that's kind of what it reminds me of. It made such a beautiful photo versus just doing all marker or all crayon. So with that being said, I am now technically doing the icing on the cake. I'm doing the crayon on the inside. I made the outlines by, going down to needle on her gonial angle and also with her chin, and I'm just making for a beautiful picture of her face. This treatment can be a little bit more uncomfortable for patients. So I'm constantly asking my patient, are you breathing? How are you doing? Are you doing okay? Do you need a break? Just because that area has a lot of nerves, and just the wrong poke can really make them feel a little squeamish. So just making sure they're breathing and also taking a break if that's necessary as well is going to be huge for you and your patient. When my patients are uncomfortable, I'm also uncomfortable just because it makes me feel bad as the provider. I want to be able to go in there and do a good job with the treatment, and I really don't want to be, causing them any unnecessary pain. So that is why I numb that porthole, but also just giving them a break when they need it. She did need a break at one point when we had stopped the camera, but also keep that in mind, like that is not a big deal. I give them a little alcohol swab under their nose just to try to bring them, back to focus, and just take a second and focus on the alcohol. And it's super strong, so it will definitely, bring you back to life a little bit. So I did start a new syringe here, and I'm just really gliding that cannula slowly. I highly suggest, if you guys have any interest in learning this treatment, that you take AAFE's level 3 dermal filler course, where we go over this, how to do cannula, how to do chin filler, jawline filler, how to mark up the patient, anatomical spots on the face to be aware of. And it really brings together your prior training and just takes it to the next level. So Go ahead and get AAFE certified today, and we'll see you there.